Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Welcome again to the mini-series about body contouring. Last episode, if you didn't listen, it was all about liposuction versus body contouring. There are huge differences. Obviously, they are both body contouring procedures, but body contouring in the sense of real body contouring, now it's more involving laser technology. So there's a huge development in laser and different technologies that are allowing the body to sculpt, melt the fat, tighten the skin, improve cellulite, all of it without any surgery. So that's what these two episodes are about, okay? After this previous episode where I discussed the disadvantages of liposuction versus body contouring technology, I really hope I made my point that one versus the other is superior and that likely in the future, liposuction will become obsolete. However, in today's episode, I want to talk about different technologies we have that can destroy localized pockets of fat. And I'm going to focus on some pros and cons, advantages and disadvantages of CoolSculpting versus WarmSculpting. There are two major technologies on the market today that destroy pockets of fat, and they do it by subjecting the fat to extremes of temperature, okay? Now, the first technology to come to the market was called CoolSculpting. FDA approved in 2009. It started gaining traction in 2010, 2012. Very simple technology. A smart team of people got together, decided to devise an applicator and apply it to the areas of undesirable fat to freeze the fat, permanently destroy it, allowing the body to sculpt in a manner that would make liposuction obsolete, like I said. So the next couple of minutes is going to be a little story about my personal experience with CoolSculpting and why I don't have CoolSculpting in my practice. At the same training where I was exposed to liposuction, the hands-on liposuction, I was also trained on alternatives in the new body contouring technology at that time. That was in 2012. Obviously, I've had numerous trainings since then on all the new technologies that came on the market, but that was the start, the beginning of my training in aesthetics. There, I had my first experience on CoolSculpting. So that's 2012. I remember the name of the device that was presented at that training, and that was Zeltic. Again, Zeltic. It was actually the newest thing in 2012. Again, FDA approved it in 2009. Zeltic was a public company located in Pleasanton, California. They marketed and licensed the CoolSculpting cryolipolysis procedure. Cryolipolysis, destroying fat, right? Since they've had it approved by the FDA in about 2009, 2010. They held the largest market share for non-invasive fat reduction procedures for many, many years. It was founded in 2005, and then the company's name was changed to Zeltic in 2007, and then the Zeltic CoolSculpting procedure was first approved for the flanks and the sides in 2010. By 2011, it was already approved in 46 other countries. And the FDA approved the treatment of the stomach, the abdomen through CoolSculpting in 2012. And they made a new model to treat difficult to reach areas like the thighs. So then the FDA approved the new model in 2014. And their sole product for this company, the only product, CoolSculpting, is currently the main cryolipolysis device available on the market. Now in 2017, Allergan, the huge company that makes Botox, purchased the Zeltic CoolSculpting technology for $2.5 billion. So the more a technology is on the market, the more extensively it is used, we are more likely to become aware of its limitations and side effects and issues that were not necessarily disclosed not because of information being withheld, but more about it wasn't clear because the initial studies are always made on a limited amount of people. Once you release it to the masses, to the large number of providers and countries everywhere, well, stuff is going to happen, right? Stuff that we didn't know about, okay? So as with any new technology, when it's released and when it is taken off to the whole wide world, there will be some spas or clinics that will want to use it for situations that do not exactly fit the picture. But hey, maybe it will work. Some bad outcomes came to light throughout the years. So in April 2023, ABC News actually reported, and I quote, "The popular cosmetic treatment CoolSculpting may pose a higher risk for a serious side effect than previously thought." A recently published New York Times examination, which reportedly included a review of internal documents, lawsuits, medical studies, and interviews, concluded that the risk of a possible side effect of disfigurement, only correctable by surgery, may have been previously underreported, end quote. So this is a paragraph I quoted from ABC News release in 2023. Now, I want to talk a little bit about how did CoolSculpting find themselves in the spotlight in a negative way. And that was mainly in September 2021, after supermodel Linda Evangelista alleged that CoolSculpting left her brutally disfigured, okay? And this is in quotes, brutally disfigured, because those are her own words, apparently. Now, I will come back to the rare but possible side effects that left a supermodel in a horrible situation. But first, let me tell you about my personal experience with Celtique. So in 2012, I went for my aesthetic hands-on training to Miami, Florida. At these hands-on trainings, the candidates for the training, the students themselves, are always asked they want to volunteer. Hey, do you want to volunteer to experience the technology on yourselves? I did just that during the training because I really believed that the contouring devices were really much more up my alley than the liposuction that I had already seen. And I was like, yeah, I don't want to do that. And it was not appealing at all to me. So I clearly remember they asked for a volunteer if they want to see how this device worked on the upper arms. I volunteered not because I wanted to have a treatment, but because I wanted to buy this technology and I wanted to try it on myself. I didn't want to use it on my patients without experiencing it on myself first. The treatment was supposed to last 45 minutes. Now, I'm a very highly pain-tolerant person. My staff knows I've tried all the lasers in my practice one way or the other. They all think I'm crazy because I like to do these procedures with minimal to no numbing, okay? And that includes the Morpheus. And I remember when Morpheus was introduced to my practice, Morpheus body specifically, and I wanted to try it on my neck, I put the numbing medication. It was too strong for me. I'm sensitive to lidocaine. I couldn't tolerate the numbing. I wiped it off pretty quickly. It was giving me palpitations. So the trainer, the clinical trainer for Morpheus said, well, let's do the treatment on someone else. And I said, no. Let's do it on me. Let's go ahead and do the procedure anyway. I really want to experience it. And we did. I didn't think it was that bad. It was Morpheus. It wasn't 3D Morpheus, but it was Morpheus on the neck because I didn't think it was that bad on the neck, which obviously is more sensitive than the body. I said, well, why don't we try it on my belly? So, and then I'm like, let's do it on the back of my thigh. I didn't think it was bad at all. So people thought I was crazy because I had zero numbing, right? I did it with no anesthesia, right? So the pain for the needles was not a big deal to me. I knew what to expect. Needles, boom, it wasn't a big deal. However, the reason why I made this parentheses is that when I experienced the CoolSculpting on my arms, I have to tell you that the discomfort from the freezing of my skin, not my fat, the skin freaked me out. It felt extremely weird. Then after 25 minutes, I said, you know what? I had enough. I'm done. It hurt, but it was an interesting type of pain that I had never experienced before. And probably part of that was the anxiety and not being familiar with the type of pain that I was experiencing. So I really didn't need to make sure I'm not damaging my skin. So I was like, yeah, I'm done. The next day, I woke up and I touched my upper arm on the right side where the procedure was, because I only did it on one arm, one side. I wanted to see the difference, if there was a difference. And my God, did I panic. The bottom of my upper arm, the underside of my upper arm was full of lumps, hard lumps, frozen lumps. And apparently that's something that happens, right? I started massaging the heck out of them to smooth them out instinctively without anybody telling me, hey, you might get some lumps. You need to massage them. So once I arrived at the lecture that same day, I asked the professor, hey, is this normal? I was told, oh yeah, this is normal. I'm like, yeah, thank you for telling me. Long story short, it was not a good experience. I did not like the feeling. I did not like the type of discomfort. I hated the lumps the next day. It is true the lumps went away and I massaged like crazy all day during the conference, during the flight back. I do remember correctly, in a few days, the lumps were gone. However, at that point in the conference with the lumps and the massaging I had to do, I decided, you know what? Body contouring is not there yet. It's not what I'm looking for. I would not do this to myself again, so why would I do it to my patients? And I put body contouring aside, paid no attention to it for a few years. So in 2016, I was pitched SculpSure by the SculpSure company. That is the same company that made the MonaLisa Touch laser. I had already had the MonaLisa Touch. I had a relationship with them. They brought the technology and demonstrated the treatment. Obviously, I was skeptical after the CoolSculpting. I'm like, yeah, I don't know about this. It was a completely different experience. Yes, there was some moderate sensation of cramping in my lower abdomen where I tried it, but it was a totally different sensation. And at the end of the treatment, I had no discomfort. I had no lumps. And I clearly remember after my first belly treatment, 2 to 3 weeks later, I noticed that a very tight pair of pants actually felt looser around my waist. So the fat on my belly was already shrinking. And this was just 3 weeks after the procedure. So I bought the device. I was convinced in the technology. I was convinced in the ease of the procedure. It was 25 minutes versus 45 minutes. And honestly, I've used it successfully for many patients since, almost 10 years down the road. So let me spend the next couple of minutes highlighting the cons of CoolSculpting versus WarmSculpting. First of all, they both, to give them credit, they both destroy up to 25% of the fat in the area treated. So as far as efficacy goes, they're equal, okay, in efficacy. But this is where the similarity stops. The CoolSculpting technology has some very significant downsides and disadvantages that you should be aware of should you ever consider such a technology to sculpt your body. So let me start with less serious and then go to more serious. And then I'll get to Linda Evangelista's disfiguring results. It is rather common to have redness and swelling of the area treated. It lasts a few days. You keep an eye on it longer. If you have a problem, it might be a situation, but that's very rare. It is possible to have some bruising, and that is also more likely in people who bruise easily. The redness and the swelling of the area, it's not really common with SculpSure, but you might see some redness as well, okay? Usually the redness created by heat dissipates immediately, and you don't see it lasting for more than a few hours. So it's a big difference, and there is no bruising from applying the heat, okay? Let's talk about a couple more things. Skin color changes, specifically hyperpigmentation after freezing, the darkening of the skin can happen. And though it happens rarely, and it's usually temporary, if you have a tendency to overpigment and your skin type is darker, then maybe stay away from this procedure, okay? You might also have the same issue with WarmSculpting. Heat can be troublesome to the melanocytes. However, the difference here is that during freezing, there's nothing to protect your skin. I'll come back to it. However, with WarmSculpting, the skin is maintained cool throughout the WarmSculpting procedures. It is less likely to piss off your melanocytes and irritate them during any WarmSculpting procedure because we have different technologies to keep your skin cool. We never want to heat the skin. We want the heat to deliver below the skin to the fat. And we want to prevent the heat that wants to dissipate upwards towards the skin to come up. We want to keep the heat contained to the fat at all times. So that actually protects your skin. Unfortunately, there's nothing to protect your skin pigment producing cells, the melanocytes, from 0 degrees Celsius temperature. You're just going to get it, okay? Now, let me get more serious. Number one problem is skin damage. The method of delivery of the cryo-energy, of the freezing energy, is through direct application to the skin and the fat underneath it. So there is nothing that could protect your skin. Unfortunately, the skin can and will suffer a certain degree of damage. It is not uncommon on the consent form to be revealed that there might be some numbness and tingling and possibly loss of sensation over the area of treatment that you will most likely recover within 6 months. What they don't tell you is that sometimes that damage is permanent, and that is fact. I don't know about you. I really don't want my skin frozen to death just so I can look better. So that's one of the reasons I said no. You can damage the skin with the WarmSculpting too, but people tell you, hey, it is too hot. You can lift the applicator, you can stop the procedure, just a few seconds, take a peek, make sure you have good contact. The cool sapphire plaques of the applicator for SculpSure keep the skin cool. So as long as there's good contact, there is complete safety. So the skin is never going to change or get any kind of burns. And again, there's no redness at the end of the treatment. When the treatment begins warming until the temperature is achieved, all that the patient feels at the beginning with SculpSure, it's the cold. As soon as I activate the machine, it's all cold. And you ask the patient, hey, are you cold all throughout? And they're like, yes, I'm cold. That way you know that the contact plaques are activated and chilled and protecting your skin safely. Let me talk about another technology for WarmSculpting called Photona. It is much less likely to damage the skin with Photona Tight Sculpt because you can see the skin while you treat it. The Zimmer device delivers the cool air to keep the skin cool, and you can actually have direct view of the skin while the fat underneath it is being treated. There's no way you can damage it or burn it, okay? After 30 minutes of doing a Photona Sculpt treatment, you don't even know you had a treatment, okay? Number 2, uneven and unsightly results. And this is a big one. Remember, I told you it's in order of complexity. The applicator, as it was created and engineered, had to suction the fat into the frame of the applicator closer to the point where the energy was delivered. As the cryolipolysis, the fat destruction from cryo, happens when the fat tissue is pulled between these two very cold plaques. In some cases, this can lead to very unfortunate results because the area left behind right next to the frame of the applicator that was not treated will have the appearance of an abrupt difference between healthy, undestroyed fat and cryo-treated fat. And that's creating the impression of a shark bite or a shelving. And if you're asking me what the heck is that, all you have to do is Google shark bite after CoolSculpting or Google shelving after CoolSculpting and then click images. And voila, you'll know exactly what I mean and how ugly it looks. Again, an image speaks more and louder than 1,000 words, so I'll stop here. Can you get this with WarmSculpting? No. The heat distributes evenly. And all of these devices, they have a feathering effect. So the heat just goes away into the underlying adjoining tissues. There is never any risk of shelving or shark bite appearance with WarmSculpting ever. Number 3, let's talk about location limitations. The applicators for CoolSculpting are not very flexible. Again, you have to suck the tissue into these two cool plaques. These applicators, they cannot be easily applied to curvy areas. They did add more applicators as the technology continued to develop. However, when it came out, I believe they initially just planned to treat certain areas. They did not realize the client demand for a non-liposuction destruction technology will be as high as it was, and they did not take into account the desire of the providers who purchased the technology to apply it to multiple and diverse areas of the body. It is a good technology for abdomen and love handles, but for other more curvy areas or smaller areas might not work as easily as WarmSculpting technologies, and especially in places like your arms and your legs, that shark bite can be very dangerous. So number 4, it is painful. And I kept pain on a high level of complexity and seriousness because it's significant. There is nothing to help manage the pain other than maybe nitrous oxide, right? There's no mechanism to alleviate the pain from the discomfort of attacking your skin and your nerve endings with an extremely cold temperature, which, believe me, it hurts because I experienced it. All the technologies out there that employ heat to destroy fat, which I'll talk about in a minute, use some form of a counteracting cold delivery mechanism to protect the skin from the heat. Otherwise, you will literally burn the skin. The option of using cool air to manage the sensation the high heat creates makes the procedure much more comfortable. Nothing protects you from the cryo energy. You just have to bear it. With WarmSculpting, you can chill the area that we are treating using a fan. You can use the Zimmer for chilled cool air, and the pain is much more tolerable because you can also adjust the heat level. You cannot adjust the freezing level. It is freeze or do not freeze. I have treated clients with SculpSure after they had CoolSculpting. I could crank up the heat to the highest level super quickly, get excellent results, that was a pro, within 1 or 2 treatments because their skin was already damaged. And I'm sorry to say, deadened from the CoolSculpting procedure they had before. And they kind of joked about it. They're like, hey, Dr. C, crank it up. I don't feel anything. Keep going. Now let's get more serious and let me talk about the complication that supermodel I mentioned, Linda Evangelista. And if you don't know who she is, just Google it. She's an outstandingly beautiful woman who was super famous in 1990. She was featured in George Michael's video clips. She was very famous, okay? So this complication is called paradoxical adipose hyperplasia, PAH. Now this is a rare, very rare, but very serious complication, as your desire to treat the fat cells and kill them could backfire. And instead of dying, the fat cells could increase in size and balloon up like a tumor. And this results in a very uneven, raised, firm mass of fat cells in the area treated. It only happens with cryolipolysis. It does not occur with any worm sculpting technology on the market out there. But apparently there are some people, very, very few, whose cells react very poorly to the freezing process. All fat cells die easily and without the risk of coming back at you hungry. The people who have suffered from this are very few, but it is disfiguring. And if you ask them, they would all say, I wish I had known that this was a possibility. I might have changed my mind. Again, hindsight is 20/20. Apparently, this disfiguring mass can be treated with liposuction, but apparently it comes back, which is what happened with the model Linda Evangelista. I guess something happens, it triggers and activates an unstoppable chain reaction that makes the frozen fat cells become supervillains instead of killing them. So I'm going to say no thank you to this. So see, when I decided to buy a body contouring technology in 2012, this serious side effect was not even discussed, was not well known. I wasn't told about it. So as later in 2016 and beyond, as I started treating patients with SculpSure, I was actually asked if it could help PAH, the paradoxical adipose hyperplasia. So I had 2 people that came to me and asked me. I had to research that. And when I found out what it was, I congratulated myself for not buying the technology, because one client with this problem would be one too many. However, it's interesting that nobody thought about what can they do. And if the liposuction apparently does not fix the problem, I don't think WarmSculpting would necessarily do it. And nobody in their right minds would actually charge anything, would be like, hey, I'm going to do it for free. Let's see if it works. But long story short, I don't think anybody would be interested in trying that technology to see if we can fix that problem. Now, enough about CoolSculpting and why I am not fond of it. What about worm sculpting technology? Well, I'm going to come back next week. And next week is going to be all about worm sculpting technology and so much more. I will discuss, on top of SculpSure, Photona, radiofrequency devices, I will discuss Morpheus and MSculpt technology and all the possible available non-invasive, non-surgical worm sculpting platforms. So join me next week for the next episode. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas. So please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.